Well, it really is a pleasure to be here and to be listening to so many inspiring talks. And I think you'll have gathered over the morning and early afternoon that many of the themes appear to be the same. And I'd like to present Penny Bron Cancer Care's approach to this whole dilemma of how do we support people affected by cancer. We're calling it an approach to survivorship, but really it's for anybody, including partners and supporters of people with cancer, because cancer will probably touch, we had the figures of maybe 1 in 3 of us will get cancer, which means almost all of us will know somebody who's affected by cancer and therefore be affected ourselves. And obviously, over the course of the morning, we've talked about prevention, we've talked about helping with treatment, we've talked about the effects of people who are now long-term survivors, but who are still affected by the effects of the cancer or their treatment. So I'll hope to show you, in the course of the talk, a little bit about how we go about approaching that. So I'd like to talk a little bit about our organisation, and a little bit about what we mean by the Penny Bron whole person approach. And you'll see it has many commonalities, but hopefully also I feel, having listened to this morning's talks, that it's a kind of bringing together of many of the things that we've already heard about. Let me tell you a little bit about how we started. We started more than 30 years ago and started life as the Bristol Cancer Help Centre, founded back in 1980 by Penny Bron and Pat Pilkington. Penny herself was a social worker by background who trained as an acupuncturist, who got breast cancer in her 30s and ended up setting up the Bristol Cancer Help Centre to provide the sort of care that she would have liked to be able to access herself. She had to travel abroad. She went on a massive journey of personal discovery, but also of discovery of what treatments were available, and with her friend Pat Pilkington ended up founding the Bristol Cancer Help Centre. Initially, it was set up as a very small charity, totally on sort of voluntary activity. Then it started to become more of a kind of private clinic, offering bursaries so that nobody was ever excluded because they couldn't pay, but the only way it could keep itself funded was to charge for its services. But since 2010, the organisation took the very brave decision to try and offer all our services free. And that's how we've gone on since 2010. And when I describe some of the services that we provide, you'll see that that is quite an amazing thing, because people are often staying in our centre, being fed, being housed for 5 days at a time with a lot of therapy input. But we've really made a commitment to doing that. And we've found that since we have the number of people that we're seeing and the range of people that we're seeing, feels that we've really made a good decision in that front. And really we try and offer services that offer what we call this whole person support throughout the cancer journey. And we try and integrate that into the cancer services pathway and link it to the National Cancer Survivorship Initiative so that we can work alongside conventional medicine. Because in our early days, we were finding that there was a group of people who would come to see us who were somehow separated from the conventional treatment paths, and we felt that often care was being fragmented, so that some people were not feeling that they could come to see us because they were worried about what their oncology and their cancer staff would think about it, or whether they might then be judged differently or treated differently. We've really tried in the last, I would say, 5 to 7 years to bridge that gap and to really make it much easier for some of the holistically minded NHS staff to feel able to recommend our services and able to sort of encourage people to come and take a more proactive and whole person approach to their health. And always we've tried to listen to the needs, the holistic needs of our clients when we're thinking about any sort of service development. And it's amazing. I mean, I think our organisation has changed, but also the climate in which we're operating has changed. And really starting or sort of being benchmarked in 2010 by this National Cancer Survivorship Initiative document, which recognised the unmet needs that Rob alluded to, that Beata alluded to this morning, and that Dorothy very powerfully alluded to, these unmet needs of people not feeling listened to, not feeling that their needs were being met. And they documented a series of things that they felt would address some of that people needed a personalised assessment, they needed more information, they needed care planning, and they needed supported self-management. And in that sense, we'd always been helping people manage themselves. And so it really felt that an awful lot of what we were doing already fitted very neatly into this vision document. And so we could start to work and partner with NHS organisations to develop some of our services in a way which they felt fitted with their agenda and we felt fitted with our agenda, and most importantly, really fitted with the client agenda. So we've talked a bit about where we position ourselves, but what do? We call it the Penny Bron Whole Person approach, and basically it is a holistic support program for people affected by cancer. And our model is, and I think this is just a pictorial way of describing what many people this morning have spoken about, that the medical model tends to focus just on the physical body, and even more than that, just on the part of the physical body which has been affected by cancer, just those cells, and it tends to concentrate all its attention, surgery, radiotherapy, chemotherapy, even some of the novel targeted therapies at that particular area. But Penny, back more than 30 years ago, kind of intuitively recognised that there was much more to it than that, and now modern science is showing us much more about the connections between our minds, our bodies, our spirits, and our emotions, recognising that what happens in any one part of those is affected and affects all the others. So over the years, the techniques and therapies and approaches that we've developed at Penny Bron Cancer Care have sought to build up health and resilience in all of those different areas. For some people, one area might be more important, for another area. For other people, it may be important to get the balance of the whole thing right. But helping people to really assess themselves in each of those different areas and make their own sort of supported self-care plan, so that then these different sections can my diagram's supposed to say that they can neatly sort of fit together and support each other, and almost you'll see that a shape is created there that wasn't there before, where the body can work at its best. And we heard this morning about how 2 years of intensive Gerson therapy can help the body really detoxify and work at its best. And for many people, there will be a different route into that. And as Beata said at the beginning, it feels like there's many different ways to support the body, but we feel that giving people that model so that they realise there's so much more to be done than just go along with the medical treatment, and that things that they can do can support the way that that medical treatment works. So that kind of in a nutshell is our model. And I suppose our working hypothesis is that improved self-care, and we can demonstrate this very well and easily, and there are many, as Rob Thomas indicated, many studies which show that that increases well-being and increases resilience, and that people then can cope better. And our hypothesis is that with the better coping, there can be better recovery and repair from treatment, maybe fewer late side effects, and maybe reduced recurrence. So we've seen how the early evidence, although it's incredibly hard to collect this kind of evidence because it's long-term, and because, as Rob alluded to, nobody makes a profit doing this kind of research. So we know it from other aspects of our lives that, when we're feeling better and more resilient, we throw off a cold more quickly, our immune systems help our wound healing be better. And surgeons and doctors know this really through their observation of their patients, but it's just hard to provide the concrete evidence that will make a clinical commissioning group put the money there. So that's what we try, and that's in the back of our minds, that actually helping people to improve their self-care and build their resilience will, whatever they're facing, whether it's the emotional crisis, whether it's the side effects of treatment, whether it's actually improving their long-term chances of staying disease-free, all will be better aided, and very much in the process they will feel better as a result. And that really comes down to the motivation to keep people engaged in this sort of approach. So our approach uses a combination of different things because, as I said, I think we really try and make sure there's something for all comers. So we use medical information. We try and, very much as Dorothy was saying, a lot of people come really not understanding what's happening in their body, not understanding why the different treatments that they've been offered have been chosen and what are the risks and benefits, and don't feel able to make informed decisions about that. We use psychological, emotional and group support, and the group support is a very, very powerful ingredient of what we do, because a lot of our interventions, as you'll hear, are group interventions, and the support that other people can give each other is not to be underestimated. We talk a lot about lifestyle advice, and you'll hear more about that. We teach people a range of self-help techniques, including meditation, relaxation, imagery, visualization, and we offer complementary therapies as well. And the approach has been developed and refined over the years by doctors, nurses, therapists, and the people with cancer. And it's designed to work alongside medical treatment. So people shouldn't ever feel that there's a conflict or that there's a problem pursuing both paths. And we work now, I would say over the last 5 years, we've worked much more closely with our oncology colleagues who've come into our centre to give talks. Nurses from the chemotherapy day unit come on a regular basis every fortnight to sort of speak to some of our clients. So it really does feel like it's beginning to be more integrated than at any point in the past. And it's really about giving people practical tools to live well. So Dorothy said it's all about living well. That's, you know, our courses, our sort of flagship course is called Living Well with the Impact of Cancer. So I think we're all singing from the same hymn sheet in a sense, it just slightly different way. So the sorts of medical information we'll give to people will include explaining what is cancer. And I think some people really don't realise that cancer cells are being formed in their bodies all the time and that we do have powerful inherent mechanisms to deal with, to detect and destroy cancer cells. So we give them that information. We talk a lot about the relaxation and the stress response, and we help people to assess where they are on that and teach them about the physiology of stress and how states of chronic stress are immune suppressant and what people can do to shift themselves from a sympathetic stress response to a parasympathetic relaxation response. We feel it's really important to not to sort of patronise our clients and to sort of give them the information that we would want. And so at whatever level. And so we talk about some of the sort of more detailed science. We talk psychoneuroimmunology is a long, complicated word, but often people get really excited when they hear that the mind has a direct effect via the nervous system on the cells of the immune system. And we often, now this hopefully will work, we often show them a little video. So I don't know if anybody of you have ever gone to a lecture by David Servan-Schreiber. Does the name David Servan-Schreiber ring any bells? He's written a fantastic book called Anti-Cancer, A New Way of Life, which really describes this holistic approach. And I was lucky enough to go to a lecture of his in San Francisco, and he showed this short video, which is actually a YouTube clip. So I tell people if you want to see it, you can just go on YouTube, search granulocytes kill cervical cancer cells. Because it's YouTube, sometimes there's a little advert that we have to skip. But basically, this is a speeded up video. I'll just stop it there for a minute. A speeded up video of human white blood cells, granulocytes, which are neutrophils. So these are not the primary specialized cells that are the most specialized at dealing with cancer cells. These cells are actually cells that are more specialized to deal with bacterial infections. So often I say to clients when I show this video, this is the B team, but they're easier to collect under the microscope. So this is why they're used in this film. And all that's happened in this film is that they've been speeded up, but they've been mixed in a test tube with some human cancer of the cervix cells, and this is what happens. So this is just to show people the power of their own immune system. So the big round cell is the cancer cell, and the little fast-moving cells are the body's neutrophils, or granulocytes. And I often stop, yeah. You can almost see that there's a little tube being formed between one of the neutrophils and the cancer cell. Because often people ask, well, if my body's destroying cancer cells all the time, why don't I feel it? Why don't I have the same side effects as if I was having a course of chemotherapy? And I show them this and say it's incredibly targeted. We talk about targeted therapy in modern medicine as if it was an invention that we'd made, but actually the neutrophils are highly targeted and will only take out cells that they are concerned about or that have abnormalities which are threatening the life of the organism. And you can see that it's made a little tunnel so that it's injecting the killer poison that it needs to destroy that cell from the inside down that little tube without any spillage or side effects into the remaining area, so that other normal cells are left completely undamaged. So there's another cancer cell there you can see with the yellow arrow. We also share with people some of the exciting scientific discoveries in epigenetics, which is showing that what's written into our genes isn't necessarily expressed in our lives, and that actually our lifestyles and the environment can have much more of an effect. He talked about tumor suppressor genes being switched on by certain healthy lifestyle changes and tumor promoter genes being switched off. There's been some long-term studies of people meditating, and the control group who didn't meditate compared to the group who were meditating on a regular basis showed upregulation of certain genes, downregulation of certain other genes. So again, it's just opening the potential. We also talk a lot about nutrition. We talk about, in general terms, giving people the idea that an anti-inflammatory, unprocessed, low glycemic index, plant-based diet is the most conducive to general health. And accepting that everybody's individual as well. So those are our general guidelines, and they fit very, I think, from what Rob was saying, I think many of the foods, we encourage a variety and colour so that we can get that synergistic effect that he was talking about using one chemical but not in excess, balancing it with other chemicals, and using food very much as nature has presented them to us. And we talk about some of the newer and very exciting research that's showing how important the bacteria that live in our gut are in terms of affecting our mood, our function, but also the way our physiology plays out. And so thinking about that aspect of ourselves and how food and lifestyle may affect our microbiome, the bacteria that live in our gut as well. And we also, Rob mentioned the Dean Ornish work, so I'm not going to go into that in a lot of detail, but it's this combination. Dean Ornish, rather than say, I'm interested in one aspect of it, he thought he'd taken a comprehensive lifestyle program, manage it very intensely. So his group were supported to make pretty intensive lifestyle changes. It was a low-fat, plant-based diet. They were regularly meeting for psychosocial support. They were taught yoga techniques and doing aerobic exercise on a very regular basis. And as he said, he elegantly showed that in a group of people who weren't receiving any other treatment but who were being followed up for prostate cancer, there were significant changes, not just a slowing down of the growth, but an actual reversal of some of the changes, both in terms of the chemical, the PSA, which is a marker of activity of prostate cancer, but also physically in terms of the size of the cancer. This is MRI spectroscopy, where the red area shows the active cancer, and a year after being on the program, that area was smaller but also less intensely active. And as he said, this is the slide where they took the blood from the cancer patients who'd been on his program and mixed it with cancer cells in the test tube, and showed that the blood of people who'd taken part of this comprehensive lifestyle program was much more active at inhibiting the cancer cell growth. So he's really done that. The other interesting thing that he did in that study was to look at how much people changed their lives and how much inhibition of cancer cell growth in the test tube there was. And he showed that people who, what he called at a high adherence, so the people in this right-hand column, stuck with the program more than 88%, they had the biggest degree of inhibition of cancer cell growth. One of the important things that we do is to try and get people to think about themselves as experts in their own physiology, and to try and map their own sort of self-regulation in terms of how they feel these different aspects of their life are affecting their health. And as I said, each person is slightly different, and each person may identify a different area that they feel they may want to work on more, or that they feel is stressing their system more than other areas. But these are some of the things that we get people to think about, and it's very important to bear in mind, especially with people affected by cancer, their physical symptoms, and not to neglect those, because they can often dominate, and so that we can do whatever we can to help with symptom control and help them get the best care they can. But as well, thinking, well, you can have the best care in the world, but if actually your support and your relationships aren't working well, or you're feeling that your creativity is completely stifled, or you're feeling that you can't sleep and that your energy levels are rubbish. So we get people to map themselves and then be part of planning their program. So our approach then would really be that we map the holistic needs of people, and we try and then fit an intervention that will most closely meet those needs. All our services are developed with those different threads in, and so most of our services will have facets of these things. So we definitely help them look at their nutrition, so they assess it, but we will also give them guidance and help them see how they can make practical changes. Exercise facilitation, we help them set realistic goals for themselves and help them plan in manageable ways. We use relaxation, guided imagery and meditation an awful lot and encourage that as part of the package. We offer counselling and support groups and very much peer support, as I've said, in a very peaceful setting. So often if people do come and stay at the centre, it is time out where they can reappraise things. I think it was Rob mentioned this idea of a teachable moment, and often we see that having a diagnosis of cancer, or sometimes it's when the cancer comes back, sometimes it's having a relative who's been diagnosed with cancer, it suddenly changes everything. And people are really prepared at that point to reappraise an awful lot and just need the time and the space to do that. So I wouldn't underestimate time and space alongside all these other things that we've been talking about. And complementary therapy is often also often give another supportive, non-verbal and allowing another person to be there alongside. Dorothy put it really nicely with the sort of, just having some physical touch often is just incredibly healing. So let's just break those down a little bit more. Nutritional intervention, we come back to this in many ways. We encourage people to just enjoy their food, and so sometimes we may not give as prescriptive advice as some may expect, but we're trying to get people on board with the idea that the joy of living is more motivating ultimately than the fear of dying. A lot of people come to us in a very fearful state and we're prepared to make changes because of fear. But what we've found over the years is that sustaining that change really comes when people actually start enjoying what they're doing and feeling better for it. So we encourage, we give cooking demonstrations where one of our nutritional therapists is also a home economist and also had an agriculture background, so she knows food and she knows food sourcing and she can bring history of food into it, and she makes it a very enjoyable and very sort of empowering experience. But we also offer one-to-one consultations with a nutritional therapist where more specific needs can be discussed, because some people are ready to make huge changes, some people need encouragement to make much smaller step-by-step changes. And we also, very importantly, run a course called Foods to Nourish Body and Soul. And I think this is part of our sort of joining it all up, because we recognise the spiritual aspects of food as well and the social aspects of food, and helping people really develop a relationship with their food that then means that they feel much more connected to it and much less likely to buy some synthetic process, something that you can't really recognise what it ever came from, and much more likely to choose something that's lived well and that is colourful and maybe a little bit more bumpy than the straight carrot that you get in the Waitrose package or the Asda sort of pack. So we're trying to encourage those multi-dimensional aspects of all of our interventions. I've talked a little bit about the plate, and Rob's talked about it. We definitely want to encourage variety, and we want to encourage some of those really helpful phytochemicals and nutraceuticals that have kind of been squished out of our diet as we've gone for easy flavourings with fat and salt and sugar. We've replaced some of the things, the herbs and the spices that would have traditionally given us so many more helpful phytochemicals. So that's really at the centre of things. So that's the food aspect of things. Physical activity, it's supervised, it's tailored to individual ability. And again, the point is to try and get people engaged with something that they enjoy. Very interesting research shows that the same physical activity done as part of your daily work produces less beneficial effects than if it's done as part of your journey to and from work, and that's even less beneficial effects than if you're doing it purely for recreation. So we really try and get people to kind of enjoy their activity, and we run regular group classes in yoga, in Nordic walking. We have tasters and regular sessions of Tai Chi type, Qigong type exercises. We have exercise facilitators who've done the CAN Rehab course, which is a special cancer rehabilitation course aimed at physical activity instructors, and it's taken to a sort of level 4 level, and Rob Thomas has helped set up one of those training courses as well. And Biodanza is again another kind of dance and music-based form of activity that a lot of our clients really find very enjoyable and a great way to engage, especially people who haven't been very physically active. And Rob's talked a lot about the benefits of exercise in all sorts, the fact that prognosis can really be improved, and the fact that often being told, and I often quote Rob saying that sometimes he's sitting in a room talking about the pros and cons of a chemotherapy regime which might make 8% difference, whereas he knows if he could get that person exercising, it could be as much as a 50% difference in recurrence rate. So really trying to just reinforce that information so that people can understand why we're talking about it. We use a lot of mind, body and creative interventions as well, for a number of different reasons. We try and help counter the myth that a lot of people come to us with, that if you're going to beat cancer, you've got to be happy and upbeat the whole time. And I think that we find puts a lot of stress on people. And Beata mentioned the mind, but it mentioned actually helping people express the emotions and not sort of comforting them too quickly, or not sort of telling them to kind of chin up. And so actually helping people be okay with expressing their authentic emotions, but also recognizing that chronic depression and other chronic stress states are not a healthy state for people to be in, so helping them out of that. And we use a lot of group work with that, but also can offer one-to-one work and couples work as well. And we can offer telephone couples support for people who are too far away from the centre, who live too far away from the centre to come regularly. And we do use complementary therapies. We have a number of therapists who are on our paid staff, and we find, as I've said, that at certain times in the journey, the support of another person offering supportive complementary therapy can be very helpful, but also complementary therapy can have some very direct specific effects, particularly in terms of side effects of treatments, particularly in terms of troublesome pain or fatigue levels. And so we try and take a pragmatic, what we call a pragmatic evidence-informed approach to complementary therapies, because when you go and consult the literature, as Rob sort of kind of alluded to, often the systematic reviews just say, yes, there have been many studies done, but the results are kind of some positive, some negative, and mostly they're too small to draw any firm conclusions, and the bottom line always seems to be more research needs to be done, which is fine if you've got all the time in the world, but actually if you're somebody faced with difficult symptoms right now, then our approach is safety first. So we always choose complementary therapies with a favourable risk-benefit ratio, especially if people are in the middle of undergoing complex cancer treatments, radiotherapy or chemotherapy. And we help them to sort of taste and try out various therapies, because actually often, regardless of what the evidence says, if somebody says it's helping them, then it's helping them. If they say it's not much use, even though the evidence says it should help them, then it's not helping them. So we offer taster sessions of a number of different therapies so that they can work out what supports them. So I just want to tell you a little bit about the way we package our services, because that's changed over the years as well. And we recognise that a lot of people are just very new to this whole approach, and especially since we've gone free, and especially as we've started getting more referrals from our NHS colleagues, we're having people come into our service who really have never thought that how they lived their life had any impact on actually their health, and certainly not on a diagnosis of whether or not they would be diagnosed with cancer. So we offer a taster day where people can kind of see the place, meet us, realise that we're not all, what did Beata say, hippies sitting under a bush smoking cannabis, and kind of that actually there is, just get a flavour of what this might entail. Then we run Living Well courses, which are, I'll tell you a little bit more about. We run a treatment support clinic for people who are in the middle of or preparing for or recovering from active cancer treatments from chemotherapy and radiotherapy, and we run that very much in partnership with the local oncology centre. And we have more of an outpatient facility as well, where people can dip into groups, classes, or one-to-one therapy sessions in a way that's much more tailor-made package. But that's obviously for people who live locally. And then, as I've hinted with the retreats, we also have some more residential follow-on courses for people who want to individualise the approach a bit more fully, or who want to come back and take it a little bit deeper, either at a nutritional level, or a physical level, or a psychological level, or a spiritual level. We've said how really the National Cancer Survivorship Initiative vision document stimulated us to sort of package some of what we'd been doing over the last 30 years into a course which we now call the Living Well with the Impact of Cancer course. And that was specifically designed to meet this sort of stated survivorship need. And we base it on 6 areas in which people are impacted by the diagnosis of cancer, because this is how Macmillan and the government-funded NCSI felt that it was most useful to address the needs, and it certainly served our course well. So we take elements of the course, which is run as a 2-day residential, or run over 3 afternoons on consecutive weeks, or run over 7 2-hour slots over consecutive weeks. So there's many different ways that we can package it. We've designed that course around these different aspects, and we go into showing how people can make a difference to their own health and well-being in each of these different areas. Each course is delivered by 2 trained facilitators, and we do a mix. Sometimes it's just for people, say, with prostate cancer. Sometimes it's just for people with ovarian cancer. Sometimes it's generic and mixed across a whole range of cancer sites. And always it's, actually we've run a couple of just for women with metastatic breast cancer, but other than that, it's usually a real mix of people who may just have been diagnosed to some people who've been living with their cancer for many, many years. This is a very, very brief summary. People were asked to say what their biggest concern was, say what their second concern was, and then to rate their overall well-being. And actually just in terms of before and after the course, mostly which were offered just over a weekend or a two-day period, you could see that already their concerns were being addressed, and actually well-being concerns had already improved just after the 2 days of the course. And actually these were statistically and clinically significant changes, because a change of 1 on this MICOR scale, we call it, is considered clinically significant. And these changes persisted, so that actually people after 12 months were feeling that overall their quality of life had improved, their physical well-being had improved, emotional, functional and spiritual well-being had improved. A few people commented when they came to the Centre for courses that they had found the travelling quite hard, and I think Dorothy alluded to that too, that we're often dealing with a population who already have enough on their plate than wanting to do a lot of travelling. So the Living Well course was then expanded out, and we've now got 5 regional centres around the country where we offer the Living Well courses in partnership with other organisations often, so with local NHS organisations or local community organisations or sometimes local cancer charities. And so we're running a programme of Living Well courses all around the country, and this map just shows where they are and where our regional facilitators are. We've trained up a number of facilitators who live out in those regions who can deliver those courses. The other project I just wanted to tell you a little bit more about was the Treatment Support Clinic, which I alluded to earlier, because I think this is quite groundbreaking, certainly in our experience, in terms of how much cooperation and collaboration there's been with the oncology teams. And we've had oncologists come out, have regular input from the chemotherapy nurses and the radiographers who are providing the radiotherapy, so that we're helping people prepare and get through their treatment with as much self-control and self-management. And Beata mentioned this vacuum feed. You know, once you're diagnosed with cancer, you feel like you've been sucked into a big vacuum cleaner where nothing that you do is of any sort of, where nothing you do can really change what's going to happen. Rob talked about how important it is for women who are having chemotherapy for breast cancer not to put on weight, but actually often that's exactly what happens, because of the steroids they're put on, because of the dietary advice they're given, and because of, you know, just how it affects their mood and their ability to cope. So helping people stay well through treatment really feels like a priority if we're going to help them as long-term survivors. And as I said at the beginning, our theory is that if we keep people well through treatment, maybe we might minimise some of the late effects, maybe some of that depression that typically kicks in, some of those physical symptoms, that fatigue. If we get people exercising early on, there's evidence that they're much more likely to stay exercising beyond their treatment than if we try and start it after treatment. So we're really trying to work with the self-management agenda. And we communicate with the oncology staff, get details of their treatment, they get details of what we've been talking to the patients about. And as part of that clinic, it's a Monday morning clinic. So having listened to Dorothy now, I wonder what would happen if we ran it on a Tuesday. But our numbers don't seem to be too bad on a Monday morning. And it's a drop-in so that people kind of let us know if they're coming, but there's no expectation that they'll come every week. Although we do encourage them to try and come at least 3 sessions in fairly close succession, just to get an idea, because we rotate the speakers and we rotate the information sessions. So the educational sessions will be talking about some of the things that I talked about before, but also might be about the way chemotherapy works or the way radiotherapy works, or about how to get the best out of your anti-sickness medication. It might be about, we've had psychologists come, we've had people from the local Walks for Health group come and talk about what's available in the region. So the educational session is for the mind. Then we get people doing a bit of light exercise. And often people think, you know, oh my goodness, I'm in the middle of treatment. Some people come the day before treatment, the day after treatment, but we still get them to exercise. And we really encourage them to sort of grade themselves as to what they feel capable of. The social support for there is fantastic too. They have a break with a healthy snack and often drinks, and often taste is a real problem going through chemo. So we try and help them understand how you can use natural flavourings and natural ingredients to sort of compensate for that lack of taste and that sort of metallic taste that sometimes affects people right the way through treatment. They all do a guided relaxation together, and often they absolutely love that. And just giving people the experience of switching off for a while. We've got some incredibly comfy chairs that people can lean back in and relax in. And often people say that's the first time I really knew what it felt like to feel relaxed. And then they have the option of some acupuncture, which is a treatment that our local oncologists feel very happy to give alongside chemotherapy because it's not a chemical-based thing. So we've had a lot of support with that, and actually have found it to be incredibly helpful symptomatically for a number of patients. And obviously there's the peer support, you're meeting other people, and for a lot of people that's the main thing, that finally they can talk about some of the things and just say, I don't feel embarrassed to talk about this because I know everybody's in the same boat. This was one comment from one of the treatment support clinic users. It's definitely improved my well-being. It's inspired me to focus on living with my condition more positively. I've never looked forward to Monday mornings so much before. And that's quite a nice thing to hear, when not only is it a Monday morning, but it's a Monday morning while you're on chemo, so that's not too bad. We do, as I said, have a day clinic. What's nice about the day clinic is that it's client-focused, and they have an opportunity for a real holistic assessment and an introduction to all the services that we offer, so they can tailor-make their own programme. And there's a variety of therapies. We do offer one-to-one sessions with a doctor where maybe medical questions can be answered. We're not a second opinion, and we don't prescribe or deliver any treatments ourselves as doctors, but we do help to make sense of things and often provide a sort of sounding board for some of the difficult decisions that they're facing, or some of the weighing up possible interventions. And we're also a good source of what's going on locally in terms of supporting people with cancer. And we liaise very closely with the local Macmillan information service for that. We have a helpline too, which is staffed by trained volunteers, and which often is a first port of call for many of the people who are calling us. They also provide some of the follow-up support after people have been on one of our courses, and that's really important because people can have a great experience, really enjoy meeting the group, feel very bonded, but then it becomes quite hard to maintain some of those healthy sort of changes further down the line. And so we follow people up with a phone call after they've attended a Living Well course, see how things are going for them, see whether they might need some of our other services. And we're looking at bolstering that even more. It's interesting that Macmillan and the National Cancer Survivorship Initiative have kind of revisited their report 3 years later, and I think made it fit even more closely with some of the things that we're talking about. So sustaining recovery, promoting recovery, supporting people, and improving survivorship intelligence. So that, really trying to give people the tools and the information that they need to make their own journeys as good as possible. I think it is really, really important that when we give people the tools with which they can make a difference to themselves, I think it's important that we balance this with some realism as well, because I feel very privileged as a doctor to work in an environment where I feel I'm not causing too many people too many side effects. I work as a GP as well, and a lot of times I'm often explaining to them, well, we'll give you this medicine, it should help this, but it might cause this, this, and this. Whereas a lot of the interventions that we use at Pennybron, I feel absolutely confident if they're not making you feel better, then we need to think again and kind of change things, but they're not going to make you feel worse. But the one thing I do think that we can sometimes do is give people a big guilt burden, that somehow by talking about things that they can do to make things better, we can end up making them feel that they caused their cancer in the first place, and that if they don't do well, it's their own fault and they blame themselves. And so we often do really try and help put this in perspective and say that probably a third of what happens to us is directly under our control. For another third, we need the help and support of other people, maybe a good surgeon, maybe a fantastic Gerson support therapist, but then probably a third is not under anybody's control. And so all we're helping people to do is do the best they can with what they can. And I think giving people permission to lay some of that burden down, or to ask for support as well, is really, really important, because it can feel, especially for some people, as if they have to take on this extra burden of sort of responsibility for everything. Here are a few quotes from people who attended a Living Well course. I don't know if you want me to read them. I've got on my bicycle more for short journeys, left the car at home, walked for pleasure. These may seem like small changes, but actually the evidence shows that moving somebody from somebody who is in the most inactive quartile up can make quite a profound difference. I'm leaving with a feeling of hope rather than just having to accept and feel angry about a diagnosis. I found the course life-changing. And I think this is lovely. It helped me to look forward to the future rather than just treading water in the present. And I think that's often how people, especially in that vacuum cleaner phase, feel that they're sort of just keeping up. And it's not everybody, but it's a significant proportion of the people we see end up making changes that really do make them feel like they've made, that they haven't been as well in the past.